Now we allow public comment on the agenda items, if there is specific agenda items. And there's nothing online? No. At this time, seeing no public comment, we'll move to the approval of the minutes from the previous board meeting. Can I have a motion to approve the minutes?
Second.
Sorry, who second?
Lily.
Lily. Okay. The motion's been seconded. All in favor?
Aye.
Aye.
All right. The aye, everybody approved. So we have the approval of our minutes. At this time, we have our board updates, and we begin with the Delaware County Health Department operational update by the Health Department Director.
Yeah, thank you, Chairwoman Rosemary Hall. So my board updates today, really, one thing that wasn't on my list, though, was to bring some attention to the positive press we've been receiving about our one-year recap. So if you haven't seen that, please feel free to find our press release. I believe it is also on the website. We put our updates there on our news. I think it really does a nice job of recapping where we've had some high-level successes throughout the year. So in addition to that, we talked a little bit about wanting to hear COVID, if there were going to be surges post-holiday. And honestly, I'm very happy to report that we've not seen case surges post-holiday. And, you know, as we look at why that might be happening, it's all of the things that happen in public health and public health preventions and protections in collaboration with health systems. So we may not want to call it a success, but ultimately I think we're really kind of moving into an area where we're successfully sort of managing COVID. Now that could always change, but with vaccinations and natural immunity, we're having people not having the same infection rates. Behavior changes have become very obvious when even within our workplace, we've noticed that if people don't feel ill enough to stay home, but may just have a sniffle, they're tending to, you know, wear a mask and practice improved hygiene. Our testing availability, whether they're free tests available or testing access, has improved, and we're not exceeding the demand for that. And then knowing that we have better therapeutics to treat people that have actually been diagnosed with COVID. So ultimately, it feels like we're moving into a place where it seems to be almost more manageable, and hopefully we stay in that direction. The other update that I had, which is very feeling quite exciting, is moving into our community health assessment. So we've talked about community health assessments being done regionally as well. I will call them topic specific, whether it's around maternal child health or it may be around lead poisoning prevention. We're learning that there's been a number of assessments that have been done sort of topical. What we're moving into is a comprehensive community health assessment, which should, the goal is to pull together in a picture of the state of the health of Delaware County with the data that we're able to collect, whether that's secondary data, different CDC, state systems, or primary data, where we'll be seeking feedback for that. So the team has been well identified on who's going to be working on it. Out of the data and epidemiology team is the lead. Having a consultant who has quite a bit of experience doing community health assessments, keeping us on our time-bound milestones and helping project manage, knowing that this is the first time Delaware County Health Department has ever done a health assessment. We were looking for where do we find that sweet spot for some accountability. So that's in place, and then moving into an internal work group to help frame that up so it's not done in a vacuum. It's going to cross all the divisions of the health department. And then pulling together a steering committee, which actually is stakeholders and partners that then can inform the process, be part of how we implement the action items, and then really begin to help own this, champion it for the county. So a lot of times I will say things, the community health assessment, the community health improvement plan, they're real pillar documents for a public health department, though the health department may author them, provide resources to implement them, but ultimately the community should feel connected to that, be able to understand what's being presented, and also navigate with the improvements So we end up functioning as a chief health strategist, as we say, really working with the community and partners and stakeholders and moving this forward. So I'm really saying it's a pretty big step in the right direction of getting us some data metrics that says, okay, from what we can determine, this is the state of the health of Delaware County. And then I was asked to provide some large, overreaching, broad sort of goals per division. So I asked each of the division administrators to work within their teams and say, you know, I know you have lofty aspirations for the entire year of 2023, but if there was one thing that you want to look back on and say you accomplished this in 2023, what would that be? So that's how I sort of framed it for them. So in environmental health, theirs was conduct transition planning with the state to develop operational procedures for our Delaware County Health Department on-lot septic system program. In personal health, it was to integrate remaining COVID vaccination efforts into routine Delaware County Health Department immunization clinical operations. For EPI, I stole their thunder a little bit, complete the community health assessment. Population health, they want to build out the public health emergency preparedness program and continue coordination with the medical countermeasures activities and medical and citizen volunteer reserve corps in the programs at the Department of Emergency Services, so incorporating those two entities. And then administration, we put together two: develop, finalize, and implement policies and procedures to bring infrastructure stability to the department, and then move into strategic planning sessions and implement performance management framework. So that's my small report for this evening.
Does anybody have any questions or comments for Melissa? Okay, thank you.
You're welcome.
And at this time, we will have a presentation. So what we're going to do throughout this year to highlight the different divisions of the health department and get a deeper dive into how they're working and their plans, we'll have at each of the Board of Health meetings this year a presentation by one of the administrators. And luckily today it's Stephanie Reese, the Personal Health Administrator, and I give it the floor to Stephanie.
All right. Thank you, Rosemary. Good to see you. Good evening, everyone, and Happy New Year to you all. Good to see you all. So I'm Stephanie Reese. I'm the administrator for Personal Health, and I want to thank you for an opportunity to brag a little bit about Personal Health. I did put together a PowerPoint presentation that I'll share. If you have any questions, feel free to ask along the way, or you can hold them to the end. It's up to you. And let me get this started. Okay, and slideshow. I don't know if it's showing it. Nope. There we go. All right, so I'm Stephanie Reese again, Division of Personal Health. And I presented this here, a slide right here, and this one of my favorite quotes, which is, the way to get started is to quit talking and begin doing. So February of 2022, we had an opportunity to present to you the Delaware County Health Department and what we have plans to do for the year of 2022 and going forward. This is a picture of the accomplishments under the leadership of Director Lyon that we've accomplished so far this year, this amazing team that you see on this picture. So we talked about what we're going to do, and we started doing it. So we'll go through where Personal Health stands today. So some of the items I'm going to go over this evening with you all are maternal child health initiatives. So we covered immunizations, we'll cover pregnancy testing services, maternal child health nurse case management services, which covers childhood-led and perinatal Hep B, up-and-coming doula program. And under our communicable diseases, we'll cover HIV and STDs, tuberculosis, And then under EPI are reportable diseases, infections and conditions, and rabies and animal bites. All right, so as you all know, our mission is to protect and promote health, to prevent disease and injury, and to cultivate conditions by which Delco residents can be healthy. The Delaware County Health Department offers a variety of public health services to protect and promote health to our residents. So we monitor the health of our communities, we identify and respond to health threats, we provide timely and accurate information, and we provide quality services to prevent and control diseases. So to start off, we'll cover immunizations for children and adults. There's two specific programs from which the state supports us with, and one is the vaccines for children, which you'll hear called VFC, and the other one is our 317, which is a program that offers free immunizations to adults. The Vaccines for Children program is offered to protect children from age birth to 18 from certain preventable childhood illnesses. What we do in our office, we review immunizations and are certain that the child is current on immunizations, administer immunizations, and we review potential adverse reactions. In that process, we also need to do an eligibility process, to make sure that they meet the eligibility requirements per the state. And some of that criteria would be children with Medicaid as their primary or secondary insurance, uninsured or underinsured children, American Indian or Alaska Native, and children with health insurance but without vaccine coverage, which qualifies as underinsured. And those who have insurance but all the immunizations are not covered under their insurance. For each visit, whether it was the day before yesterday or yesterday, we have to go through this eligibility screening with them when they come back in. Under 317, it's a little more straightforward. These patients can only be uninsured. And these are adults 18 and over or 19 and over. And the vaccines that we're currently offering in our clinics are the hepatitis A and B, the HPV, the flu shot, meningococcal, MMR, pneumococcal, tetanus, and varicella. And in the future, we will be expanding as we see a need in the community. Also under our
Attention, please. It is now 6:50, and the cafeteria will be closing in 45 minutes.
Under our immunization program, we also have a homebound program. This program offers homebound individuals the opportunity to receive both COVID-19 and flu vaccines in the home setting. Eligibility includes those that are having difficulties getting vaccinated related to their disabilities, health issues, and transportation access, and other things could come into play that will make them eligible for homebound. As part of this program, personal care attendants, family, and other caregivers or residents of the household are eligible to be vaccinated during the same visit. So when we go out there and we find that they have a grandchild or anyone in their household that's not vaccinated and are interested in getting the vaccination, we'll give it to them for free as well. Before I move on to the next slide, as Director Lyon mentioned, our goal for 2023 is to implement or integrate our COVID vaccine clinics into our daily routine immunization clinics at the sites, both at Yaden and Chester. So we had a planning meeting this week, and we're looking to at least start piloting it in Chester starting in February, and hoping that goes well, and then we can eventually move forward with integrating those seamlessly into the immunization clinics. Any questions?
Hi, this is Anne Marie. I just wanted to know, for the COVID, would the eligibility criteria apply to the COVID vaccines as well, or would that be a different set of criteria for COVID?
Yep, thanks for that question. It's a different set of criteria. So right now, since COVID is still federally funded, we will continue to offer that at no cost. We also have in stock flu, which falls under VFC, and flu that we bought through the county. So we have an option there. Well, so if they qualify for VFC or 317, we'll give them a flu shot from that stock. If they do not, we'll give them it from our personal stock.
Thank you.
You're welcome.
Stephanie, this is PJ Brennan. What will we do when the federal government isn't subsidizing COVID vaccines, which could happen in the relatively near future?
Well, that is something that Director Lyon and Deputy Director Laura and I had some communication about. I'm not sure where we landed on that. Director Lyon.
So thanks, Stephanie, for launching that back to me. So we'll follow the state to find out if they will, sometimes the state then will pick up the purchasing of that or payment of that or how that would look. And then if they do, then they typically offer them to county municipal health departments. But then if not, then we'd have to go what we would call, like, just as we're doing with influenza, do private stock purchase. And I mean, we would explore that, but I can't say that we've done a deep dive into the planning of that right now.
Thank you, Director Lyon. Any other questions? Okay, so I'll move into our most recent initiative that we started in personal health or in the health department. It was our pregnancy testing services. So we offer to women who are concerned that they may be pregnant or have missed their menses if their period is late. And what we do there is we just collect a simple urine sample and the test is done and results are given within 5 minutes. And if the pregnancy test is positive, we offer counseling with referrals to outside agencies. So we've put together a very comprehensive list of community partners who can support with whatever their decision is with the pregnancy, whatever supports they would need, whether it's adoption or a doula program or PCPs in the area that may be able to, OBGYNs that may be able to support them. What we also done with this testing is we've implemented in our STD, HIV program. So that team also is now ensuring that everyone that comes in for testing, every female, is offered pregnancy testing as well. We're doing this at both in Yeadon and Chester. Appointments are not necessary, recommended but not necessary. Any questions? All right, so we'll move into our maternal child health, nursing case management services. So we have our childhood lead poisoning and our perinatal Hep B. So to look at the lead poisoning portion of this, daily lead level cases are reported through our PA-NED system and filtered to identify lead poisoning cases that's 3.5 or above. If case definition is met, outreach and education is provided through phone calls and mailings. This includes nutrition, food prep, housekeeping, etc. We also work closely with county services, our Department of Human Services, and we have a great contact over there, Narcia Hill, who helps with mitigation and early intervention services. And then there's a 3-month follow-up on existing cases for home inspection, remediation, and repeat blood work for the child. So this is in coordination with our epidemiologist, Victor Roulan, who's very hands-on with this as well, and helping us keep track of the data for this. Under perinatal hepatitis B, so this is the case management of expectant mothers with hepatitis B and their infants to ensure the infants get vaccinated with a 3-dose series of hepatitis B vaccine. This is done at birth, and then again 1 or 2 months old, and then 6 months old. Infants followed through 9 months and I meant to say 1 to 2 months after the first dose, and then 6 months after the second dose. Infants follow through 9 months of age to establish either immunity or transmission of the disease. And this is done through blood work. And some of the education, the things that we're doing, communication and education is sent via mailings and phone calls once a month. And then once the results are received, and then consistent NEDS documentation. So we have to constantly go in, update NEDS with communication to the family. And then communication with the state hepatitis B program coordinator and infants pediatrician. So this case management is, it happens between the primary care physician, the OBGYN, and the state, and then our team, just making sure this is a seamless process for the mother and the child. Any questions?
Yeah, Stephanie, I have a couple questions. For the lead, how are you getting the lead results of the patients?
And two, is the home inspection being done by your program, or is that refer out to another program for the home inspection?
Yeah, so the lead levels are reported through PA-NET. So once the laboratory, so everything that comes through lead is coming from a laboratory. So that's how we're getting them. Regarding you're talking about the remediation?
The home inspection.
The home inspection, that's done through Department of Human Services. And I believe that they are using, and Rosemary may know more, an outside vendor that goes out and does this.
Oh, okay. So it's also, in Delaware County, the Office of Housing and Urban Development does the lead remediation program for the county. So they receive the HUD funding, and they fortunately, we have the health department who now directly communicates. And so when a case is identified, they automatically have a call into that office to follow up with the family to see if they will allow the house inspection and remediation. And good news is that additional dollars was just approved by the Pennsylvania legislature. So Delaware County is eligible for even more money coming up in 2023.
Yep. Thank you, Rosemary. And just to be clear, so once we identify a case, we forward it to our contact, Nasia Hill, who takes it from there, and then follows up with us with what happened with that family.
And a question about the perinatal Hep B, is that being reported directly to the Delco Department of Health, or is that you're getting that information from the Pennsylvania Department of Health that a patient has perinatal hepatitis B?
So we're actually getting that from the Pennsylvania Pennsylvania Department of Health. So what happens is they really should be reporting it into NEDS or to us, but it's still a coordination with the health department, the Pennsylvania State Health Department, and a lady named Sherry Manier, who's up there. She's getting a lot of the reports and managing that as well. So a lot of it is coming through her.
So Stephanie, should education be provided for the providers to make sure they report directly to Delaware County Department of Health, or is the preference to have them report directly to the Pennsylvania Department of Health?
Yeah, absolutely. So education is being done as we're, moving along in this process to ensure that they are reporting into us, communicating with us. So we've made lots of connections. We've developed a lot of good relationships so far. One of the things that we were told early on is that in Delaware County, early on, that there were a lot of change and with the medical providers and the offices. So we were falling short in the area of, managing perinatal Hep B. We've since then gotten huge compliments on how far we've come with handling the cases, identifying the moms, and connecting with the primary cares. And Sherry has been very helpful with also engaging with the primary care offices or physicians and ensuring that they too know to be reaching out to us. So it's a work in progress. It's working though. I'll tell you, I've seen so much change within, with the providers now reaching out to us. So at some point it'll be a total switch, but right now it's still a process of them learning and being, educating. And, once they know, our perinatal Hep B nurse Ariel Deal, she's been now starting to get out in the field to make sure that they're putting a name with the face and making those connections.
Thank you.
You're welcome. Any other questions before I move? Okay. All right. So it's almost breaking news here. So our doula and baby first program. So early on in the process, we talked about starting a baby first program here in Delaware County. Haven't quite gotten to get that up off the ground this year, but this program goal is to address Black maternal health and overall concerns of access to services with maternal and child health here in Delaware County. So we recently, in the past couple of weeks for the fiscal year 23, the Delaware County Perinatal Community Health Worker and Doula pilot program was approved. We are receiving grant monies to be able to support this program. And it's still in the early phases. And it's my understanding that we're going to be forming a maternal child health committee to advance plans for implementation. And I think, I know Director Lyon, Rosemary Hall, Dr. Taylor, they're all part of this implementation and putting this committee together. And Senator Casey's office will be working with us for the timing of making this announcement to the residents. So we're looking forward to, bringing this program to light. We understand there's a true need in the community. We have an experienced person who works for us in our maternal child health division named Michaela, who is a doula, and she has some ideas already in place prior to this grant, how we wanted to move this forward. So I'm really looking forward to seeing this program through.
Stephanie, is this program basically the department's hiring their own doulas and providing that the doula services?
Yeah, so definitely no, not in year one. It's something eventually maybe we want to look into, but I think we might, and I think once we work with the committee, we'll know more, but we'll probably outsource a lot of this and work with our community partners that's currently doing this and kind of can have the resources to support it. Any other questions? Okay. All right, so we'll talk about our HIV and STD clinics. So we are offering free testing and treatment for STD prevention services, treatment, educational awareness, and testing and partner notifications at both clinics, which is Yaden and Chester. So far, what we've been doing in these clinics is the distribution of brochures, literature, and condoms. And we test and treat for the following. And then I've also listed methods in which we test. So for syphilis, we do blood draws. For gonorrhea and chlamydia, we do urine, throat, anal, and vaginal swabs. And for HIV, we're only doing blood draws. We're not doing treatment in our office. The managed care is actually referred out to one of our partners. And right now we work very closely with the AIDS care group. Any questions? Okay. And then under our further under communicable disease and surveillance, this is, all the other reportable diseases that fall under communicable disease outside of the STIs and HIV. And this program works towards surveillance, investigation, and education regarding the spread and prevention of reportable communicable diseases. So our team, through investigation, determines the confirmation of the reported disease. Again, this comes through our PA-NET system. There are 75 reportable diseases which require investigation and are reported through the National Electronic Disease Surveillance System. And that's where you hear me say PA-NETs. Chlamydia, syphilis, gonorrhea, HIV is only investigated with the STD HIV team because of the nature of its work. So the team that does the other 71 reportable diseases will not do the STDs. And some of the things that we've recently, now all of these, we do outbreak and surveillance and management. And recently, and I just listed these, but it's way more, we've had outbreaks of RSV, chickenpox, some measles, COVID, and Ebola that our team have been totally hands-on with, working with the state. And a lot of these they have found to be in long-term care facilities.
And Steph, this is Melissa. I just want to make sure that I give a clarification that to draw attention to outbreak, surveillance, and management. And in the Ebola, we have not had a case of Ebola, but what we do is we do the surveillance of a traveler that may have come from an endemic area where Ebola is present. And that has taken the team quite a bit of time just based on the nature of the questions and the daily monitoring. So just wanted to make sure that I brought attention to that so that individuals understand that we don't have a case, but we do the surveillance and the management to make sure that we're preventing any type of cases from being identified.
Yeah, thanks for clarifying that, Dr.
Dr.
Lyon. Second time you were called a doctor today.
Stephanie, I'm just wondering, just ballpark numbers, how many travelers have you had to follow
Yeah, I'm going off of, it's 6. Thank you, phone a friend in the audience. I would have said between 5 and 6. So 6.
5.5.
5 and a half. So we've 6. And they've all completed their monitoring, I believe. 1 active. Okay. Thank you.
Thank you. All right, and then we have tuberculosis. And so we have a tuberculosis clinic as well, and all services are free for that as well. And patients receive the quantiferin gold test in place of PPD, so we're not doing PPDs in the office. If indeed it turns out to be positive, then they are sent to the hospital for a chest x-ray to confirm. And the one thing I want to talk about with tuberculosis is that we are not just treating the illness or diagnosis, but we are supporting patients individually. So we're looking at their cultural, spiritual, and physiological needs to provide patient-centered care. We have an amazing nurse in place who really advocates for our patients to make sure that they have all the needs in place to be able to get through this, their treatment plans. So we deal with housing issues, utilities being on, transportation. So there's so many things that wraparound services that we do with our tuberculosis patients. We are developing relationships within the community that have populations highly vulnerable to infection and poor healthcare access, such as the immigrants that have come in. We're working closely with the state to make sure that all of those folks are receiving the treatment, the testing, and everything they need. And then we also have our EDOT or VDOT program put into place to monitor patient progress and TB program performance. This results-oriented system is an important feature for treatment and future cure of tuberculosis. And this is where, and I'm probably familiar with it, but what we do is we have to observe these patients taking their medication, and there's sometimes transportation issues or just can't get out the house for whatever reason. So we have an EDOT specialist who does, I'll say Zoom or Teams meetings, and she observes them taking their medications. So it helps us with managing the program, ensuring that patients are staying compliant with their treatment plans. Any questions?
Yes, Stephanie, do you separate infection or latent infection as opposed to tuberculosis disease? Do you separate those two categories?
We do, and you're talking about the LTBIs?
Well, it used to be called latent, now it's just called infection right now, I believe. I'm gonna ask my infectious disease expert here. It used to be called latent, but they don't call that anymore.
We do separate them. Right now, the state does not require that we report or treat for LTBI. It's really optional. So right now we are, we do separate them out.
Do you have, I'm just curious what the numbers look like in Delaware County at this time. I'm not sure if you have that information.
Yeah, so in terms of active TB, the last week report I had was 9 active.
Stephanie, are you doing any in-person directly observed therapy, or is it all virtual?
Yep. So for the first 2 weeks, we're required to do in person. So we have a registered nurse go out to the home for the first 2 weeks to observe. And once we ensure there's compliant that way, then we move them into EDOT. You're welcome.
Hey, Stephanie, this is Melissa. Is there ever a time that you would move someone out of the EDOT program back to direct observational therapy in person?
Yeah, absolutely. So we haven't run into that issue yet, but we've thought about how this will work, and if we're not able to get the person on the phone or on EDOT, or they're just not answering, we would definitely need to go back out to the home for that and move them out the program until we get compliance from them.
Thank you.
Mm-hmm. Any other questions? Okay. And then here we have rabies or an animal bites. So by Pennsylvania law, all animal bites to humans in Pennsylvania must be reported by medical professionals to the Pennsylvania Department of Health or Delaware County Health Department now. If a person has been bitten, scratched, or otherwise exposed to saliva of a mammal that is suspected of having rabies, the animal must be tested for rabies. And the only way to test for rabies is to euthanize the animal and have it submitted to an approved laboratory for rabies testing. The Delaware County Health Department, it comes in spurts. Like we'll get a lot of reports about animal bites. It's sometimes we have to work closely with environmental health, just to kind of have them help with checking on the animal or the family that owns the pet. And we don't carry the rabies shot. So families they have to go to the ED if indeed they feel like they've been exposed. Any questions? All right, and last but not least, all of this work would not be possible without this team you see in front of you. So these are the fearless supervisors that work in the Division of Personal Health. I'll start with Christy Murray. She is our maternal child health supervisor. She's also a registered nurse, and she has been with us for 4 months. She's doing a fabulous job and making sure that things are running smoothly in our division there. Kimberly Nardone. Kimberly's been with us since we were COVID task force, and she's now a nursing supervisor, and she pretty much oversees tuberculosis, STD, HIV. So she is and pretty much stationary in our Chester office. So all the operations down there with regards to clinical falls under Kimberly Nardone. Carol Von Collin. She's our communicable disease supervisor, and I put epi because she falls under somewhat under the epi division where they're monitoring the other 71 communicable diseases outside of STDs. And then Herman Wilson. Herman is our disease intervention specialist supervisor. And he manages our disease intervention specialists, and we have 3 currently. We have Casey, Tatiana, and Bernetta, and they're responsible for doing all the work for STDs and HIV. And thank you. Any questions?
Thank you, Stephanie. I think that was a great report and really shows all the work that has happened in the last year, particularly between getting started and moving forward to actually doing all the disease monitoring and interventions that you're doing. I'm really pleased to see the pregnancy testing. I think that's a great add-in for the health department, and just congratulate everybody on the great work.
Yep, thank you. I'll let them know. I appreciate it. Thank you for your time.
Thank you.
Thank you, Stephanie. Well done.
Any other questions from the board?
I would just comment that it's really, Stephanie didn't talk about the demographics of the people affected by this, but these will be largely underserved, underinsured populations, oftentimes foreign-born, perhaps without English language skills, and difficulty accessing care, and the ability to offer vaccines and therapies to them is a major accomplishment. So kudos to Stephanie and her team.
Thank you very much. I appreciate it.
And I want to make a comment about how we are able to communicate to those very underserved, language, obviously poor language skill, how we're able to communicate that this is available to that population.
And I'm happy to add as well that through the community health assessment process, we should be able to have those demographics. As we do this, state of the health of Delaware County, the intention will be to identify, are there particular populations that are disproportionately suffering from a certain disease or chronic condition? And then is it something that the health department can address and has resources for, or are we mobilizing the community to help address those things and partners that way? So, looking forward to really having this much bigger picture and focusing our direction to accomplish that. very important and looking forward to that work.
So with the community health assessment and with the work you're doing around personal health, are you disaggregating the data to be able to dig a little deeper to find out where these pockets of these different community members are? Because if it's just very broad, then it's harder to find that out.
Yep. So I think, so the Board of Health will be briefed regularly throughout the health assessment process. So you'll be able to see where the data is coming from, how we're doing the community engagement component. So there's qualitative and quantitative data that helps inform the whole process. So we'll have some aggregate data that is Delaware County specific. In fact, I wish I had the exact wording. We made sure that we said the goal of the community health assessment was to identify hyper-local data, because I know how important that was for the Board of Health, especially during the formation of the health department, is that, great, we may already have our hands on statewide data or regional data, but how does this really inform Delaware County down to, not my favorite, but zip code level, if you would like. So we're moving in that direction.
So
I hope that's helpful.
Yeah, so what are you using to collect that data? Is it?
Oh, there's multiple, like it's not just one, it's all types of, I would need, you know what? I think this would be a great opportunity for me to have, next time we'll have the EPI team really come in and frame out where they're getting that from.
Okay. And then with the personal health of Stephanie's team, are you doing the same in terms of collecting more specific data? Disaggregating, no?
No,
Okay.
not at this time.
So is there a plan for that? Because I know we've,
So are you suggesting?
like country of birth, those kinds of things.
Say that again?
Country of birth data or language.
So Steph, do you want to answer the demographic data to that?
Well, I mean, a lot of that we can generate and pull from PA Nets right now. I don't know if you have anything to add, Director Lyon, but I know that is the plan, and particularly when we get our EHR in place, so that we can pull that in and be able to analyze it.
Yep.
But right now we do have a spreadsheet. It's not foolproof right now. But yeah, and we can pull that from PA Nets as well.
So yeah, I think the EHR was exactly the direction I was going to go in answering that question. So we've already had an approval to have an EHR. Electronic health record or electronic medical record. We're going to refer ours more to electronic health record through the system that we're already using for our environmental health inspections. CDP can provide that service. So they're actually starting the planning meetings and moving in that direction. So if you're asking the question of how we will do that internally, that's in development. So we're getting all of the tools to pull that together. I hope that helps, Owen.
Okay. Yeah, because I know the Philadelphia Department of Health, they're trying to figure that out now. So I'm hoping we can start early. And
yeah.
Okay, great. Great discussion. So at this time, I just wanted to check to see if any of the board members, well, thanks, Stephanie, for your thing. And just hold on a minute, just in case somebody does. But the division reports were sent to all the Board of Health members. And if anyone had any specific question about the division reports, including Stephanie's division or any other section.
So I didn't have a question as much as a request for, and this is kind of along the lines of what we were talking about. I appreciate that the EPI reports the demographic breakdown of the COVID vaccinations, et cetera. I saw some charts. And I think it would be helpful to us to have context in terms of how does that reflect Delaware County's population or the population we're expecting, to help us understand if there are gaps or if there are certain populations we're not getting to. So just more context around what those numbers mean to us and how we can use them to make sure we're getting to everybody we need to.
So I think that's a good place to start for the EPI.
Oh yeah, I'm thinking in my head, like I have these conversations on the daily internally at the health department. So I noted, and I just looked at Laura. She's on it.
Oh, okay.
Sorry, you didn't. That was silent language that was just sort of happening there. Like
I saw it, and I just wanted.
I'll vocalize it. Yes, we will provide something with additional context.
Yeah. Anybody else? I was just going to note, from my reading, I just wanted to really call out nearly the 7,000 calls done by the call center, which is really impressive for the year. And then, that we are making excellent work on the inspections for environmental health and how that's all kind of really coming together. I think we're really noting that they completed all the necessary inspections that were required for this year, which is, I think, a huge achievement, and really just wanted to highlight those in my reading of the report.
Thank you.
Okay.
And we can also remind, maybe for those that are hearing for the first time or may watch the recording, that the division reports do become part of the official meeting minutes, so they become public record.
Great. Okay, with no further questions, at this time, we can move into public comment. So just as a reminder, if you are making public comment today, please come to the podium. Please give your name and address. And we have a fancy timer that has been implemented by the County Council that is now going to be used by us as well. So it'll give you will have your time up on the screen if anybody wants to make comment.
Good evening. Bill McIntyre, 215 Cherry Hill Lane in Marple Township. And again, congratulations on your first year ending, and starting something from scratch and getting where you are is quite an accomplishment. And again, Happy New Year to all of you. One of the things I thought was really interesting in the presentation was the slide about rabies. Most people think of rabies as bitten by a dog. I live in Marple Newtown, or Marple Township, and there's woods behind us. And usually there are cases every year of rabid animals being found in the township. Actually, at one point there was a rabid raccoon in my backyard. I was able to dispose of it. I notified the police, and they told me that there was rabid foxes in the area, so on and so forth. But one of the things I think is really critical is the education. People say, okay, dogs, wild dog, this, that, and the other. With wild animals, it's almost as if they're tame. The raccoon was out in broad daylight, showed no fear whatsoever. A child would think, oh, it's tame, it's a pet. And it's actually the opposite. When animals are doing something that they're not normally supposed to do, see you and run away, be out in the daylight when they're nocturnal, those are the things that are, real strong indicators that there's something wrong, and rabies is possibly the cause. So again, as you guys put out all kinds of really good information like that, rabies isn't just confined to, wild dog populations or cities or this, that, and the other. No, great outdoors in the back, they're there, and it's what you would, as a child, I would be fascinated. Oh, look, a nice little raccoon's coming up. It was my son who was young at the time. Dad, there was a raccoon in the backyard acting strange. And when I got there, it certainly was, and I've seen rabid raccoons in the past out in Lancaster County and stuff like that. So again, that's really neat that you're coming up with that. Appreciate it. And if there's any way you can inform people, it's not just limited to dogs. And when you see an animal that's acting, strange, be alert. Okay, thanks again.
Thank you. Okay, any other public comments? Seeing no other public comments, I will also give a moment for the board to have, if they have any other remarks or comments for tonight.
I'll just make another comment about vaccines. I think we've kind of lost sight of the significance of vaccines, because so many vaccine preventable diseases we no longer see anymore. I was out in Ohio over the holidays. There's a significant outbreak of measles in Columbus, Ohio. I think 81 children were affected. 78 of them had been unvaccinated, in one of the largest metropolitan areas in the country. And so, the program that we have here is really important in reaching vulnerable populations that are uninsured or have limited access to care. And we really have to keep pushing on these vaccine-preventable diseases.
Thank you. And I think it's really important, and you brought up a good point, and it's just the public education on so many of these things. And so, you know, I think the health department is moving forward to doing a lot more education this year, and luckily we have our new communications person that will help in that. So I think we all agree that, you know, getting the public updated on the current issues is really important.
Agreed. Thank you.
And Melissa and your team, I just want to, you know, I know this has been the first year in building a new health department, but you all have really done a great job so far. So thank you.
Thank you. I mean, the end of the year recap, I think, really allowed all of us to reflect. We often lose sight of what we've accomplished, and we only look forward to what we still need to accomplish, and that can be a grind. So I really did want to, you know, call attention to, we've done really great work in a very short period of time.
Yeah. All right. Well, with that happy note, I will adjourn the meeting. Our next meeting is March the 2nd, and we look forward to seeing you then. Thank you.
Thank you.